So hemorrhoidal disease is one of the most common benign disorders of GI tract. Hemorrhoids are vascular cushions forming the tight seal around your anus and prevent seepage of the feces from the rectum. Enlargement of hemorrhoids cause a variety of symptoms, including bleeding upon defecation, anal seepage or anal fecal solid, pruritus, anal pain, as well as mucosal prolapse. The pathogenesis of hemorrhoids are multifactorial, and risk factors for developing hemorrhoids are obesity, pregnancy, constipation, strangulation during the defecation, heavy weightlifting, sitting for a long period of time, especially on the toilet, as well as genetic susceptibility. So treatment of hemorrhoids is divided into two main groups, conservative treatment and surgical treatment. The conservative treatment should be considered as concomitant therapy independent of the stage and severity of the disease. Conservative treatment contains stool softener, high fiber diet, sufficient fluid intake, avoiding excessive straining on defecation, use of drugs, suppository ointments, and creams to reduce the hemorrhoidal symptoms. Such medications used to alleviate the symptoms usually are anti-inflammatory, analgesic, or local anesthetics. The surgical treatment depends on the stage and severity of the symptoms and disease. Minimally invasive treatment can be offered to patients in an outpatient setting, and that includes hemorrhoidal banding on laser hemorrhoidoplasty. And for more advanced hemorrhoidal disease, more invasive surgical procedures are required. And they divide by ligation techniques such as DHD, which is a Doppler-guided hemorrhoidal artery ligation with or without mucosal pexy, as well as excisional hemorrhoidectomy. Well, generally speaking, modification of the risk factors can prevent hemorrhoids to happen. So basically try to reduce the weight loss, use the stool softener, high fiber diet rich in the fruits and vegetables, avoid sedentary lifestyle, physical activities. These all factors reduce the risk of development of hemorrhoids. One should be obviously slightly careful with heavy weightliftings, and in the case of weightlifts, less weight and more intensity of exercise should be considered. So recovery process differ slightly between ligation procedure and resection hemorrhoidectomy. Basically, after ligation procedure, the pain is shorter in duration and recovery process is faster. But on average, a patient can experience perianal pain, especially after defecation, for 2 to 3 weeks. This could be alleviated by taking anti-inflammatory medication, painkillers, and short-term antibiotics such as metronidazole. Also, bed rest and avoid strained physical activities is required for 2 to 3 weeks.